chose these two cases because they highlight some very interesting points. We do see, about 50% of our practice is gastrointestinal issues of all different kinds, and bloating is a big one. And if you really look at the statistics, there was a study done in 2011 that showed that about 31% of the American population complains of bloating. And if you look at specifically the IBS population, so about 90% of the patients who have either been diagnosed with IBS or IBS-like symptoms, 90% of them choose bloating as one of their symptoms in their symptom questionnaire. So bloating is really a very persistent problem. It's a very common problem that people experience. So if you look at these two cases, the first one, this was a patient who came to me about 2 years back, and 57-year-old, and she was already postmenopausal. She had been diagnosed with gastritis, and she had been taking antacids for years, and she'd been on Pepcid for many years, and that was keeping her gastritis symptoms under control. But the reason she was coming to me was because of bloating. She had this discomfort that wouldn't go away, and she constantly had gurgles, and that wouldn't let her sleep at night. That's how loud they were. Like, she would lie down, she would fall asleep, and she would wake up in the middle of the night, and she'd say, "I hear these gurgles." And you know what her backup plan was? She would eat, because that's the only thing that would quieten the gurgles, and then she would go back to sleep. So she had been doing this for years, and then she was kind of frustrated, and she was looking for answers. So she called in, and in her intake, I found out that she was already, because she'd had this problem for so many years, she was already well educated. She had tried many different things. She had already eliminated gluten and dairy, which she thought helped to keep her symptoms less severe. And but she said, I still want to see what else I could do. So we ran a few tests for her. One of the things I did was a food sensitivity panel. Because her diet was already pretty clean, I didn't feel the need to, take away things that she might not be sensitive to. And we found that actually she was sensitive to quite a few things, and we eliminated those, and I've listed them in here. We eliminated those as a starter, but I also did a stool test, just to see what else is going on in her gut. She didn't have any infections per se, no parasitic infections, but we did find that she was having a hard time digesting her fats, and she did have some overgrowth of some unfavorable strains in her gut. So that triggered the next test. Because she had this overgrowth of some unfavorable strains, I had her test for SIBO, which is our small intestinal bacterial overgrowth, and yes, she was positive. Once we treated her for that. So for her, in her case, what we ended up doing, because she had suffered for so long, we didn't wait to try any other things. We eliminated those sensitive foods, and we gave her a prescription for the SIBO. Within probably about 4 weeks of her prescription that she had taken for the SIBO, her symptoms turned around magically, you can say, but it was not magically, but she felt different. She's like, I'm not waking up in the middle of the night. I do hear the gurgles, but they're not as loud. Then I do feel a difference. So within 4 weeks of the antibiotic treatment, she had quite a huge change. And then, of course, it took us a while to rehabilitate her gut, because she did still have trouble digesting fat. So we changed her diet slowly. We gave her the enzymes she needed, rehabilitated her gut to the point. It's been 2 years since then, since her SIBO treatment, and she's eating pretty much everything. And when I say everything, she's even eating, because she was not celiac, and because she was not lactose intolerant, she can even tolerate dairy and gluten in small amounts. And she knows her limits. She knows if she eats above a certain limit, she will get symptoms. If she keeps it within that amount, she's actually able to enjoy all the different foods, even the ones that were on her food sensitivity panel. So she's almost to the point where she calls herself normal. She says, I don't have symptoms anymore. And when she starts seeing kind of the downhill pattern, she just self-corrects. She's like, okay, I get off the gluten and dairy, I get off those sensitive foods, and I get back on track, and I'm fine. So that I think it's a very interesting case to remember, that when there is a need for testing, and when there is a need for using prescriptions, it's important to do it as and when needed. And then the second case, again, you can see a very different demographic, a younger female, a 17-year-old, and she was actually already treated for SIBO even before she came into our office. So she had been suffering with bloating and pain for a while. She had seen a gastroenterologist. She had been treated for SIBO. What she realized was that her pain had gone away after the SIBO treatment, but her bloating remained. And that was a mystery to her. And it was about 6 months before she tried different things for her bloating. She waited for about 6 months before she came into our office, and she said, I've tried this and this, nothing seems to change. And what her parent told me, who was in the visit with her, is that she has a lot of anxiety about it, because this was one of the patients who brought in a before and after picture. So you can imagine a 17-year-old, she's very conscious about the way she looks. And she said, I actually look like I'm pregnant when I'm bloated. And that's very embarrassing. I don't want to be seen like this with my friends. And so in her case, when we did the full case taking, one thing I realized was anxiety was really high. So we did a lot of mind-body work with her. At the same time, simple lifestyle changes were key. So even though she had been treated for the infection, nobody had sat down and asked her how she eats or how she drinks her water. So water intake was critical. She was barely drinking any water. So we got her to incorporate water into her daily lifestyle, made sure that she's eating regularly. Another thing that she was doing was because she didn't want to get bloated after a meal, instead of having 3 meals a day, she was just snacking through the day. And she thought that would help or prevent her from getting bloated, which was actually doing the opposite. So we had her eat 3 different meals and nothing in between. We gave her that 4-hour gap. And then, of course, like I said, stress management. So a lot of mind-body work with her. Just by making these simple changes, we were still waiting for her stool test. By her 3rd visit, she herself used this word, said 75% my bloating is gone. And I don't know, I can't tell you what the pattern is. And I asked her, I said, can you tell me what a pattern is? When are you experiencing it now? She said, no, I still can't tell if there is a specific food that's causing it or not. So then when we received her stool test, we found out that she, of course, was having trouble digesting fat. So even a little bit of fat in the food, it doesn't have to be excessive. Like even if she was having vegetables or chicken sauteed and like cooked in olive oil, she would get bloated because she did have trouble digesting fats overall. As we fix that, her bloating is getting better and better. And she's still an active patient, so we're still treating her, but she's doing every visit I talk to her, she's progressively done better. So you can see like there's a power to lifestyle changes, simple lifestyle changes that can work. And there's also power to using supplements or medication. That really depends on the patient. So you have to treat the patient and not just the bloating.